na tumaas pa yung kaso in the next 14 days. Anong ibig sabihin nun? So nagkakaroon pa rin ng hawahan, no, sa community. Nagkakaroon pa rin ng hawahan sa workplace, mga sa pamilya. So kailangan po mag-ingat tayo.
The Octa Research Group warns that Metro Manila could be elevated to a moderate COVID-19 risk by next week.
At the minimum, baka kakailanganin ng government na bawasan yung capacities sa public transportation or sa indoor establishments para lang at least lumuwag na konti.
If there is an indication that we have to enhance or increase the alert level to moderate so that everyone will be also conscious about the status, especially the people na talagang medyo tumaas ang kaso, then we should do that.
Malacanang has spoken. The wearing of face masks anywhere in the country is still mandatory. That's according to the national government. But Cebu Governor Gwen Garcia is standing pat on her provincial board's approval of the ordinance making masks outdoors optional. And while the face-off over face masks rages down south in Metro Manila, COVID cases are in fact rising. There's debate if raising the alert level here was just too soon. We discuss all of that in this episode of The Chiefs. Welcome to The Chiefs. Ako po si Roby Alampay at kasama po natin ngayon, mamaya-maya kasama natin si Ami Pamintuan of the Philippine Star. In the meantime, let's go straight to our first guest. Joining The Chiefs is Dr. Maricar Limpin. She is the immediate past president of the Philippine College of Physicians. Welcome back to the program, Dr. Limpin.
Yes, good evening, Roby, and good evening to everyone.
Mukhang tayong dalawa po muna.
Yes, okay lang.
So, kumustahin muna natin ang mga ospital and for that matter, still our frontliners. Alam naman natin, nagbukas na ang ekonomiya, people are mobile, nagbalik na ang traffic. We understand, nagbalik na rin ang siksikan sa mga ospital. Totoo po ba to?
Yes, nagbalik yung siksikan sa mga ospital primarily not because of COVID-19 but because of the other medical conditions that has been somewhat neglected. Hindi naman kami ang naka-neglect, but primarily yung mga tao, they were not able to take care of themselves, hindi na sila nagpakita sa mga doktor or anyone from any healthcare facilities. So medyo we are seeing really a rise in many particularly non-communicable diseases and even yung mga iba pang infectious disease like TB, So by the time we are seeing them, medyo advanced stage na yung karamihan sa kanila.
Sige, Dr. Limpin, we do want to spend some time talking about that, lalo-lalo na mga non-communicable NCDs, yung rise in TB, marami na rin nagbabanggit yan. But I want to get to the COVID situation first, because a lot of experts over these past few days have been pointing to a surge. Some are saying it's a weak surge. Whatever it is, how are you feeling this rise in numbers in the hospitals?
Of course, we're closely monitoring the COVID-19 cases. We do not want that this will continue. And we're hoping that this will not lead to more serious COVID-19 infection that will lead people to be admitted in the hospital.
Pero anong take nyo? I mean, even outside of the hospital, I guess, just based on what you're seeing, as you see people, as we said, traffic is back, mobility is back, people are making appointments, people are starting to prefer face-to-face meetings and face-to-face reunions over yung mga nakakasawa naman talagang Zoom. Diba? But do you share that sentiment and that concern that people are letting their guards down? What's your sense of it?
Well, number one, Roby, I think we really need to learn how to live with the virus. And living with the virus means that we can actually go out, as long as we practice the minimum health standards. And the minimum health standards is really making sure that we wear the face mask properly, no, every time we go out of the house, making sure whether indoor, outdoor, kailangan naka-face mask po tayo. And then we also ramp up the immunization, the vaccination campaign, ano, particularly yung booster shots natin, because we have to realize, no, Roby, we have high vaccination rate for the primary vaccines, but for the booster, no, it's a measly 15 million, no, people who have been vaccinated with their first booster shot. So we need to ramp up the booster shots.
Nabanggit niyo po, important to remind, minimum health standards pa rin, di ba? And kaya nga nabanggit niyo, very basic, minimum health standards, masks pa rin. But what does that mean is the Philippine College of Physicians, or you, taking a position on what's happening in Cebu. Dahil sa Cebu, sinabi ni Governor Garcia, hindi, optional na kami dito.
Yeah, even our colleagues, no, in Cebu are in agreement with us na this is not yet the time to let our guards down, no. So we cannot afford to not use the face mask, primarily because number one, if there will be an increase in COVID-19 cases, whether mild pa yan o moderate, you know, these people getting the COVID-19 infection will still be needing the professional help of the healthcare professionals, no? So, importanteng na matutugunan din natin ang mga health needs ng mga karamihan ng mga tao na yan. And right now, we are also seeing, you know, some of our healthcare workers that are also getting to be positive, no? And we have to realize that we lack our manpower, especially yung mga nurses natin, Roby, no? Many have actually gone out, no, of the country. And so we are left actually with very few nurses and very much wanting with the nurses, particularly doon sa mga critical care areas natin, like the ICU, the ER, the recovery room, the OR, no? Kulang tayo ng mga nurses. So we need to make sure that we will not have another surge that will lead to another lockdown, because definitely we cannot afford to have a lockdown since you know, the economy has already suffered so much. So kailangan i-continue lang natin yung the boosting up of the economy, no? Definitely ayaw na namin ng another lockdown, Roby.
Oo nga, but speaking of that, I mean, we understand naman, di ba? Parang that was also one of the rationales of Governor Garcia. Sinabi niya, you know, we have to start opening up. Sinabi niya, I'll take it from the reality of, you know, observing people in the streets. They're not wearing masks. Not to say na we necessarily take our cue from them, but at least that's her rationale. The economy is starting to open up. It will help tourism, sabi niya. But we'll get to the nurses as well. But I still want to get to what's happening in Cebu. Are we expecting numbers to diverge between the rest of the country and Cebu? I mean, are we going to see the impact of this policy, this experiment, what's happening in Cebu in the coming weeks, would you say?
Roby, no, that remains to be seen, because we know that the National Police, the Philippine National Police, have already stated that they will implement yung wearing of the face mask, no, at all times. No, it will not be optional the way Cebu governor has actually announced, no. So we'll have to wait and see. And I don't believe that it might be true, no, that there are some people who are not wearing their face mask anymore. But I think more people are wearing it more than compared to those who are not wearing it. So you know, noticing one or two out of the hundreds and thousands of people who are wearing the mask, that's not the right attitude or the right strategy that should be taken. Kailangan nga natin, no, we can actually improve our tourism, no. People are being allowed to go out. People are actually being allowed to come in, no, in the country, no, without requiring anymore the testing, no, as long as they are fully vaccinated. So I think we are doing what we need to do to improve the tourism of the country. And with the looks of it, ang dami naman pumapasok na ng mga taga-ibang bansa, no? So I think what we need to do is just continue to wear the face mask, make sure that we will not have another surge, no, which will burden our healthcare system.
Okay, well, let's get to the matter of testing. It seems to me, and it seems to a lot of people, that nobody is testing anymore unless talagang may naramdaman silang yung sintomas na, people assume that konting sipon, konting ubo, I will ride this out, even if they're telling themselves na baka COVID na to. Di ba, ang dami kong kilalang ganyan, sinasabi, baka ito na to, baka COVID na to, and so on. But people are not testing. What does that mean for our policymakers, for our frontliners, and for just getting an appreciation of what's the real situation?
Yeah, unfortunately, you are right there, no, Roby. Many people are not testing anymore, or if ever they are testing, they're doing it on their own. So, marami na ako na anuhan, no, they're doing the antigen test, and then once that they see that the antigen test is negative, so they continue. But once the antigen test is positive, no, they actually isolate themselves already, no. So parang nakikita ko naman yung proper attitude or the proper behavior, no, dapat na gawin. So unfortunately, not all of them are doing the testing already, not doing their test, no. So yun yung mga hindi gumagawa ng test. This is where our problem is, and that is why we always try to tell the government or advise the government that most of the testing kaya lang naman hindi nagagawa because they don't have the monetary means, no, to pay for the expense of the test. So pero if this is subsidized by government, then by all means I think that the people will get their test as long as it's for free.
Hi, Doktora, kasama na po natin si Ami Pamintuan. She's joining us from the port area in Manila at the Philippine Star Office. Ami?
Good evening, Doctor. Sorry I'm late. It's interesting that you mentioned that your nurses are getting sick from COVID. I'm sure that most of them are boosted, no? Siguro, by way of, hindi naman pananakot, kaya lang just to tell people kung ano nangyayari in this breakthrough infections. Kasi, well, apart from the possibility na death is still possible, no? Ano yung nangyayari sa mga breakthrough? Siguro yung worst infection, ano yung nangyayari? Kasi sabi nila, an Omicron infection is slightly different from the original virus infection. Ano yung mga symptoms?
Actually, right now, one of the most common symptoms na nararamdaman, may sore throat, no, nangangati ang lalamunan, with some may not have fever, some will have fever, and then also body pains, no. Yun ang madalas na napapakinggan namin sa mga karamihan ng tao. And even if it's mild COVID-19, but I've seen a lot of patients complaining of persistent cough long after they have already recovered from COVID-19 infection. So ito yung mga dapat natin titignan, no? Although siyempre sinasabi nga na majority are suffering only from mild COVID-19, pero there are a significant number of people still complaining of cough, medyo irritating, it's a little bit persistent and troublesome kasi laging nauubo, nangangati, and they cannot actually control the cough, no? Kasi talagang nauubo sila no matter what, how hard they try to control the coughing. Nauubo pa rin sila. So these are something that we need to look into. Majority of them na tinitingnan namin ang X-ray, and then sometimes kung hindi namin masyadong makita, wala kami masyadong makita sa X-ray, we do a request for CT scan of the chest, and lo and behold, we would find some abnormalities on the chest, no? So importante na na-check yung ating mga tao. So meaning to say, no, we do test, then that means that it will require some resources, no, some budget as far as government is concerned, to make sure that these people will remain as healthy as possible, no, even after they have come out of COVID-19 infection.
that's long COVID, and persistent coughing can put pressure on the heart, di ba? And there-
Yes, not necessarily put pressure on the heart, no? Medyo pagod, no? But of course, no, kung ikaw ay may sakit sa puso, that is going to really put pressure on the heart, no? So pwedeng magkaroon ka ng congestive heart failure. But for somebody who do not have any pre-existing heart condition, that is something that will actually put pressure on the person itself. Kasi iisipin mo, ano ba problema ko? Bakit ba ako palaging merong ubo? Hindi kaya meron na akong ibang problema, something more serious than just coughing, no? Some of them would actually think, may TB ba ako? Meron ba akong malignancy, like cancer of the lungs, no? So which will lead to these very bothersome cough.
Doktora, nabanggit niyo yung iba problema. Specifically, nabanggit niyo nga, naku, baka TB na to. And as you mentioned at the very start, na in fact, tumataas nga ang TB, tumataas din ang mga people coming in for non-communicable diseases. What's going on here?
Yes, Roby, many of our people were not able to see their doctors. Many of them, some of them actually who are on maintenance, like may maintenance sila for diabetes, may maintenance sila for hypertension. Hindi nila nakuha kasi hindi nga nila nakita yung mga doktor nila. So usually the drugstores, kung ang prescription nila ay matagal na, the drugstores will not actually give them the medicines anymore. So, ang nagiging problem ay hindi sila nakakainom, so lumalala yung sakit nila. And then for some na may TB at saka yung mga pre-existing conditions, no, hindi naalaga, hindi lalong lumalala lang yung mga sakit nila. Marami sa kanila have been coughing. Akala nila, naisip nila katulad ito, long COVID, no? Long COVID ang isa sa iniisip nila. And then lo and behold, biglang makikita namin ang pangit talaga, no? Mukhang talagang nasira ang baga nila. And then only to find out na yung TB, no? It's active TB. So we need to immediately place them on anti-TB medication. Some of them will even present not just TB, no? But mag-iisip pa kami baka may malignancy dito, no? So a lot of them, no, will need really a lot of tests, procedures to undergo procedures. So kung can you just imagine kung ikaw mahirap, then they will need the help of the government, no? And so this is going to take up a lot of budget also from the government. So kailangan siguraduhin natin na these people will be taken care of, not just those with COVID-19.
Well, balikan ko lang yung long COVID. There are also reports of COVID worsening Alzheimer's or creating brain fog. Are you also encountering that?
Oo, yes. Marami yan, and that will go on for quite some time, So sometimes it lasts for 3 months, 4 months after magkaroon ng COVID, yung iba 6 na buwan, But fortunately, some are able to recover from the brain fog, pero it takes a lot of time, and kailangan medyo palagi mo lang kausapin yung tao kasi para medyo ma-regain nila yung yung dati nilang mga memories, no? And part of the brain fog, sometimes sarili mong kapamilya, nanay mo, hindi masyado ka nakilala. Akala tuloy nagkaka-Alzheimer's na, but it's just really because of brain fog.
But Doctor, I'm also curious, ano yung impact nun, and is there a deliberate effort also on the part of your community to explain it to the private sector, for example, workplaces? Because I imagine a lot of people are saying, oh, may sakit ka na, gumaling ka na, nakapagpahinga ka na, now balik ka. But then, does our society and this private sector and the public sector for that matter, do the employers at that point that they actually not only understand but accept that long COVID is a real situation, is a real problem that they will have to factor into their HR?
Yes, kaya nga lahat kami we're all making efforts to ensure that the people who got long COVID, any signs and symptoms of long COVID, we will be able to really make sure that they will be able to go back to their work, no? So some of them will require really some certificate from the doctors, no, telling the employers, particularly the HR, that there are certain things that probably the patient will not be able to do for the moment, no? So binibigyan namin sila ng ganon, no? So we have actually medical certificates that we issue so that the employers will be able to understand the situation of the employee. And most of the employers naman do understand, no? So they give some time for the employees to be able to go back to at least very near the normal, or if not at their normal state.
Doctor, you mentioned na kulang pa rin tayo ng nurses. I understand during the pandemic, well, throughout the pandemic, there were programs to entice more people to, kahit temporary lang, to work as nurses, Kumusta yung mga programs natin for recruitment? Ngayong tapos na yung lockdowns at least.
Yeah, actually, we keep on recruiting the nurses, particularly nurses, kasi talagang marami ang nagkaroon we had an exodus of nurses. And most of them are actually the ones who have been working with us for quite a long time. And kaya they really have the experience at talagang pinapirate sila outside of the country. And hindi naman natin mapigilan because greener pasture yung pagpunta nila doon sa So I think for us, what we need to do is really keep on hiring nurses and then try to train them as fast as possible, and then make sure that for the other healthcare workers, kasi meron naman kaming mga gradation sa mga nurses. So the more senior ones will have to look after the work of the newer ones para sa ganon tinuturuan nila yung mga bago, para at least ma-minimize din natin yung mga possible errors that can be actually be committed by the new nurses. But so far, I think we're trying to cope up with hindi kami talagang masyadong marami ang lumalabas. So and there are not too many nurses really applying, So particularly maybe for the private hospitals, kasi sa private hospitals I think they need to increase the pay, the remunerations of the nurses. Alam naman natin na sa mga private hospitals mas mababa ang sweldo ng mga nurses natin compared to the government. But the private hospitals cannot also afford not to have nurses, kaya importante lang that ituloy-tuloy natin yung ating mga training na ginagawa for the nurses so that we will be able to keep up with the needs of the country.
Other than the human resource matter, and we've touched on a lot of things already, is everything that we developed and that coalesced eventually over 2 years, is all of that in place? And how much of that has been institutionalized, would you say?
Well, the testing, the way we isolate and then we treat, that has already been in place, except probably that the tracing is still not standardized across the LGUs, So depende yan doon sa LGUs. But yung system is already in place. And then as to whether yung pag-screen on whether it has to be admitted, the patients have to be admitted or not, that is also in place. The medications that we can give, that is also in place, except that in other countries, there are already newer antiviral drugs that are available, still not available in the country. So that is something na advantageous for them na medyo we are looking forward to having here in the country. The vaccination campaign is ongoing, but we really have to, we are really struggling in the sense that we are not able to really increase the vaccination rate, particularly for the booster. Yung primary vaccines is doing well, no? Pero I think really people are getting to be too complacent. So we probably have to strategize on how we can improve, no, the vaccination rate for the booster COVID-19 vaccination. So kailangan siguro, if kailangan din na kahit nga medyo i-increase lang natin yung alert level, but not necessarily,
Alert level 2.
maybe limiting the mobility, pero parang pag in-announce mo mag-increase ang alert level, pero that will probably send the signal to people na kailangan pala talaga
Pero
magpabakuna ako.
in terms of re-strategizing on the
Yes.
uptake for boosters, do you think we should just open the booster slots for anyone who wants to take it?
Of course, no. We always believe in the science, and the science will tell us that really yung mga current na criteria natin for the booster shots, particularly for the second booster shots, no. It's really the right thing that we need to do, no. So it will be for the elderly. Sa CDC, it is for 50 years old and above, no. For those with pre-existing conditions and also those who are immunocompromised, no. These are the criteria really for eligibility for the second boosters, no. So for the second booster to be available to the general population, I'm not also going to recommend that because there is no data that will show that people, the general population, will actually benefit from the second booster.
Okay.
So at least we're doing right, except that probably ang iniisip pa namin, hinihintay pa namin na ibaba ang edad sa 50 years old.
Okay. Okay, Dr. Maricar Limpin is immediate past president of the Philippine College of Physicians. Dr. Limpin, maraming salamat po.
Thank you, Doctor.
Yes, stay safe, everyone.
We will take a break. Please stay with us. The Chiefs will be right back. Welcome back to Chiefs here on One News. Is it time to raise the alert level in Metro Manila given the rise in new COVID cases? Health Undersecretary and Spokesperson Rosario Vergeire joins us now. Thanks for talking to us once again. Undersecretary Vergeire, welcome to the Chiefs.
Good evening, Usec.
Magandang gabi po. Good evening po sa inyong lahat.
Before we talk about alert levels, I want to continue lang yung pinag-uusapan natin kanina with Dr. Limpin. Specifically, naiwan yung usapan namin sa usapin ng boosters. Kamusta na po ba ang uptake ng boosters? And she was asking, what can we do to boost the uptake in boosters?
Currently, sir, we have about 54 million eligible population for our booster shots. This is the third shots. Third shot pa lang po, hindi pa yung fourth shot. Ngayon po, ang atin pong uptake would be just around 14.5 million. So 14.5 million out of the 54 million, we are waiting for the 40 million eligible for them to receive their boosters. So ganun po kababa yung uptake. Kaya po tayo medyo worried tayo because we know that the immunity of the population is already waning. And based on our projections, towards August siguro po or September, hospitalizations might increase because severe and critical will increase because of the waning immunity. These are projections, not cast in stone, but we just want people to be aware so that they may be encouraged more to receive their boosters.
In the meantime po, yung supply ng mga bakuna for this 54 million, this is for the first booster, ay kamusta po yun? Mag-expire na po ba yun?
We have enough actually, sir. No? So we have enough and ito naman po mga expiring ng mga bakuna natin. We have vaccines that are still valid or potent until the end of the year. So we are not really problematic as to the supply side. We are just really trying to improve the demand side, no? Na kailangan ma-uptake na po talaga ng population.
Pero wala ba kayong bala? Kasi there are also suggestions na sundan natin yung US CDC guidelines allowing 50-year-olds na kumuha na ng second booster. Is there any serious talk about doing the same here para siguro kahit other people will set the example, baka mas ganahan yung ibang tao na mag-third booster din kung nakikita nila yung iba, dami na ng merong second booster.
Yes, ma'am. No? So lahat po ng mga options na yan kasama po sa mga pinag-uusapan natin together with our experts and of course FDA. Kasi sa FDA po, specific yung EUA natin na talagang senior citizen. So we are now trying to explore other avenues at yung ibang options natin for these fourth shots, no, para mabigay po natin dito po sa ating mga kababayan, no, 50 and above and the others. No? So antayin lang po natin. We need evidence. Katulad po ng sabi ni Dr. Limpin, hindi naman po tayo basta-basta magbibigay. We need to base it on science.
Ma'am, maybe buti po nabanggit niyo ulit kasi kanina I wanted to clarify that also. There are a lot of people, well, not enough, but of those who have taken their first booster, tapos nagbibilang na sila, nako, yung first booster ko was 5 months ago, 6 months ago. So what we're saying is that yung pila sa first booster or yung supply ng first booster, hiwalay na hiwalay yan doon sa inaantay mong guidance on the second booster. Because some people are starting to think, kung ayaw nyo mag-booster, di ako na mauuna doon sa second booster ko. That's the wrong framing of it. It's actually two separate lines and two separate, you don't necessarily tell yourself na, 5 months ago, 6 months ago yung first booster ko, kaya nagmamadali ako makuha yung second booster ko. People shouldn't necessarily think of it and have that sense of urgency.
Yes, sir, that's right. No, that's the wrong framing, as you have said. No, kasi yung pong third doses, kaya tayo nagkaroon, nung dumating po yung mga variants of concern like Omicron, it has affected the efficacy of our vaccines. And lumabas talaga sa ebidensya na talagang nabawasan po yung protection na binibigay ng bakuna. That's why everybody, no, yun pong 18 years old and above had to receive booster so that we can be able to boost our immunity, mapunta tayo uli dun sa level ng protection na kailangan to prevent severe and critical. Now, it's different when you talk about the fourth doses because evidence have shown na yun pong pag nag-receive ka ng fourth dose, parang dumating na sa maximum effect yung bakuna. na yung benepisyo na binibigay niya sa'yo, hindi na ganun katulad ng first 3 doses mo. And actually, meron din nga pong ebidensya na lumabas din of late, na kapag you receive you're from the general population, you receive your 4th boosters, yung benepisyo niya doesn't outweigh the risk because after 1 month, the immunity again wanes. Pero merong iba kasing ebidensya na lumabas for senior citizens and the immunocompromised na talagang hindi sila makapag-produce ng enough antibodies even with just the 3rd doses. Kaya kailangan nila ng 4th. So it's different really for the general population and this vulnerable population. And it is different for your 3rd and your 4th booster.
Okay, so
doses.
the second booster is really right now specific to those senior citizens, as you said, and the immunocompromised. Because I know a lot of people, I admit, I'm one of those who are thinking, oh, kailan kami? Di ba? Parang yung sa first round, tapos sa booster, you're thinking, oh, tapos na yung immunocompromised, tapos na yung mga kailan na yung category ko. Actually, hindi pa pala kami nag-aantay ng ganun.
Yes, sir. So, sana maintindihan, kung tayo lang sa gobyerno, ang iisipin lang natin para hindi masayang ang bakuna, pamimigay po namin yan. Pero simulat sa pulpo, from the very start, we've used science and evidence to guide us.
Okay.
Most especially that we know that these are new vaccines. So,
Okay,
kailangan
isang
natin pag-aralan
quick follow-up
yan.
na lang po, and then Ami will have another question. I-clarify ko lang, nabanggit na rin ni I guess so now one thing, it turns also on one particular definition of who's a senior citizen. Is it 50 and above or is it older than that?
For us, the senior citizen starts from 60 years old. So sa ngayon po, base pa rin sa EUA ng FDA, it's 60 years old. But as I've said, it is being discussed kung pwede nating babaan hanggang 50 years old.
Sige pa.
Well, in the meantime, we are seeing an uptick in cases. At no one is talking naman about a return to lockdowns, kahit mag-alert level 2. Pero kayo, would you suggest some restrictions siguro sa capacity kasi 100% na everywhere, and you can see sa public transport, for example, talagang siksikan na, and not everyone is wearing masks anymore. Are you suggesting any, hindi naman mobility restrictions, but greater adherence to protocols in the meantime?
Not restrictions, but greater adherence to protocols, yes. We are not at that point where we should escalate. Hindi natin kailangan na para po tayong impulsive move, na medyo tumataas sa mga kaso, biglang magsasara tayo, tapos magbubukas na naman tayo. We need to understand that the virus is here to stay. We also need to understand that infections are inevitable, mangyayari at mangyayari. What would be most important for all of us would be, kahit na may nagkakasakit, yung severe and critical natin, we maintain them at that low level and our hospitals are not getting full. That is what is important for us. We need to live with the virus.
Well, may nabanggit din si bukas yung alert level 2 Well, we're not saying it will be alert level 2. Bukas daw yung announcement for the next 2 weeks. Meron na bang from the Department of Health? Are you proposing an escalation or restrictions or any special measures?
Well, we stick with the alert level system, ma'am. So we think, and we are the ones who recommended this to IATF, the alert level system, because we think that it is comprehensive enough to cover, for us to have these flags or these signals dito sa ating situation. It includes already the number of cases. It also includes the hospital utilization. So pag tinignan natin, yes, there are increases in different areas of the country. Nakita natin, tumataas din ang positivity rate. But ang maganda sa nangyayari ngayon, bagamat mayroong mga pagtaas, ang ating mga ospital are being maintained to have that level na hindi sila napupuno. Pangalawa, yung ating severe and critical, katulad ng sabi ko, it's not really increasing. Stable siya doon. So we are closely monitoring, but for now, we stick to our alert level system. Kung ano po yung ipapakita ng sitwasyon natin sa ngayon, that is what we are going to decide on based on IATF's decision.
Pati yung emergency status kasi, the business community is pushing for the abolition of the emergency system. Ano ba impact nun if you abolish?
Well, there are a lot of implications if you lift the state of calamity that was authorized by the Office of the President through an executive order. It is valid until September of this year. And once you lift that state of calamity, you cannot use our emergency use authority anymore. So the implications would be with our vaccines and our drugs for COVID that we are using now. Second, the healthcare workers incentives that we give right now is highly reliant on this executive order, because even in the law that was recently passed for healthcare workers, it stated that when there is a public health emergency, that when we are under a state of calamity, the healthcare workers will receive these kind of benefits. Now, if you lift that, and then all of these incentives will stop. And of course, we have tax exemptions because of this state of calamity. And the authority of local governments to use their funds for this COVID-19 response would also be stopped. So there are a lot of operational implications when we do that. And aside from these operational implications, we have to think, we have to look at our situation right now. Subvariants have entered the country, BA 2.12.1, BA.4, BA.5, and as a result, we are seeing an increase in the number of cases in areas in the country. Our mobility pattern is like that of the pre-pandemic already, and then there is waning immunity. So at this current situation, we think that it should not still be lifted, that we should go on and continuously monitor and be vigilant. We will reach that point wherein the number of cases are already acceptable and we are already able to manage these operational implications. And that maybe that time would be the appropriate time for us to lift this state of calamity.
Now, speaking
so,
of other...
siguro September. Kasi hanggang doon effective yung order. You think by September pwede nang i-review?
Of course, that will be reviewed by the new administration, ma'am. Opo. Pero yung operational implications, we are starting to work on that already. Para naman kung sakasakali nga magkaroon ng ganyang decision, we can also manage without all of these benefits that we receive because of the state of calamity. And also, hopefully also, by that time, in September, cases would really be acceptable na to us na kahit na tumataas, pero hindi naman talaga napupuno ng ospital, walang mga severe at critical na marami.
Ma'am, but ito, asking for a friend. Actually, asking for many, many friends. Lahat ng kino-contemplate natin, what will be the implications for travel, whether it's domestic or inbound?
Well, for now, if we stick to our alert level system, and kung nasa alert level 1 po tayo, alert level 2, travel naman po is still allowed, at these levels of the alert system. So kailangan lang talaga, katulad ng sabi po ni ma'am kanina, we strictly enforce our protocols. Marami na rin po kasing complacent ngayon. You'd find people not wearing mask anymore. You'd find people, kahit crowded na yung place, still goes there. So these are the things that we need to do. If only we will all comply with these safety protocols. Plus, if only all of this eligible population will receive their boosters, we are protected. Even cases will be there. Kayang-kaya po natin yan. We can go on and live our lives as normal as possible.
Speaking of which, Malacanang po napilitan na magsalita ngayon. Again, clarifying that ang masks are still mandatory. How's the situation in Cebu? How do we resolve that?
First, the situation in Cebu, kasama naman po siya dun sa regions na binabantayan natin ngayon. Although, katulad nga ng sabi ko, marami tayong regions na binabantayan. It's about 14 out of the 17 regions na medyo nakakakita tayo ng pagtaas. But it is still not significant. Although, mula po nung start nung June, nakikita natin na susustain yung unti-unting pagtaas ng mga kaso. As to the situation in Cebu, kanina po may narinig tayo that it was already approved by their provincial council. So, naglabas na po ng statement ang ating Office of the President based on the Constitution, according to the Department of Justice also, na may authority ang Office of the President to make our local governments comply. They are under the direct authority of the Office of the President in terms of this. Also, our law for notifiable diseases, this is the law for our public health emergency, RA 11332. Sinasabi dyan na kapag public health emergency, ang utos po o yung national government can dictate to our implementing units to comply so that we can be able to respond better. Wala pong bansa or we won't benefit dito po sa nangyayaring ganito kung hindi po tayo isa lang. There cannot be a republic within a republic. Kasi we know that the virus crosses borders. Once you lift your restrictions in one area, and you know that the virus will cross borders, transmission will continue on.
Kumusta yung vaccination and booster uptake in Cebu province?
Well, sa ngayon ang Cebu province po, kasama po sila no, doon sa tinutulungan natin dahil meron pa rin po tayong kaunting mga pangangailangan, especially among the vulnerable population like senior citizens. Hindi pa rin po ganun kataas. Pagkatapos yung sa target population po nila, kailangan pa rin po ng kaunti.
You mentioned healthcare workers. Kanina sabi ni Dr. Limpin nawawalan pa rin tayo ng nurses. We cannot keep up with the departure of nurses. Kumusta yung program natin for recruitment? Even in the government sector, I know people were trying to get more nurses throughout the pandemic. Kumusta siya?
Yes, ma'am. No? So, tama po si Dr. Limpin. We're actively recruiting. We have already provided incentives. Actually, itong mga incentives na binigay ng ating presidente through this law, isa po yan doon sa incentives dahil because of this pandemic. Another thing would be, meron po tayong mga purposive na ginagawa na hiring kung saan nakikipag-usap na po tayo ngayon sa mga universities para po dun sa production side natin. Although alam natin that it is not immediate, but at least in the long term, we can foresee na meron tayong numbers ng mga ating mga healthcare workers that we can produce on our own and they can stay here through the right incentive. So we are thoroughly discussing this because we know this is really a huge issue in terms of our healthcare system at kailangan po natin matugunan so that we can be all resilient.
And it's a bigger problem in the private sector, di ba? The private hospitals. How can the government help?
Well, the government has been helping the private hospital, not even during this pandemic. If you remember, we have had several reforms in our Philippine Health Insurance Corporation kung saan yung mga packages natin, in-include na natin yung mga healthcare workers natin. So therefore, ito pong reimbursements na tinatanggap ng ating mga ospital, expectedly dapat kasama na po yung mabayaran nila ng mas appropriate ang ating mga healthcare workers. So the private hospitals have these funds from PhilHealth that they should be getting from, so that they can increase the salary of our private hospital nurses or healthcare workers. So ito po yung isa sa nagawa na natin, and during this time of the pandemic nga, kahit po private, kahit public, kung kailangan ng nurses, kung kailangan ng healthcare workers, we try as much to deploy dun po sa mga areas na yan. Marami pa po tayong kailangan gawin para makapag-retain tayo ng ating mga healthcare workers dito, and this will require a whole of government approach.
Okay. Ma'am, ito, asking for a friend again. What's happening to the One Health Pass? I personally have had occasion to use the One Health Pass twice in the past 6 months. The first time nagamit ko yung One Health Pass, I was really impressed. In-upload ko yung vaccine records ko. I took the required antigen test before coming back. In-upload ko rin yun. Then when I came back, walang problema. About just 2 weeks ago, I came back, used the One Health Pass. Una-una, pagdating, ang haba ng pila because, well, basically, the One Health Pass wasn't working. Didn't generate a QR code for me, for a lot of people who were in line with me. And then when I finally got to the front of the line, basically, pinalabas ulit lahat ng records ko. Pinalabas yung vaccine certificate, the antigen test that I had already uploaded and that had supposedly generated a barcode for me. Pinalabas na naman yung printout. And so what's going on with One Health Pass? It's such an important question, I would imagine, especially now that we're trying to reopen to inbound tourists. It doesn't seem to be working.
Yes, actually, I do not have the answer to that. No, it's another agency of government which manages this. But what I can assume to be happening would be the sheer volume of passengers coming in the country, compared to last month, mas mataas po yata ngayon. So maybe nagkaroon na po ng bugs yung system natin. But definitely, I will be endorsing this to the appropriate agency so that they can act on this.
Well, a new problem with the easing of restrictions is kahit sa government hospitals, napupuno na raw with non-COVID cases. What's the situation now? Na-ease na ba yun, yung congestion?
Totoo po yung sinabi nyo, because of the easing of restrictions, yun ang ating mga non-COVID cases, especially our chronic cases, yung may mga diabetes, may hypertension na dati takot sila lumabas at magpa-check up. Ngayon po sila nagpuntahan sa ating mga ospital. We have about 59% admissions in our non-COVID wards. Sa ngayon po, no, sa nakikita po ng ating patient navigation and referral center natin. So we were able to manage specifically yun po talagang mga big hospitals natin na biglang napuno during that time. Na-manage naman po natin. What we are trying to establish right now and trying to work on it properly would be our navigation system. Ang nagiging problema, ang reklamo po ng mga ospital, yung mga walk-ins, no? So walang schedule, walang kahit na anong pasabi, biglang dadating na lang sa ER. So nadadagdag sila dun sa usual load ng patients ng mga ospital natin na hindi naman talaga sila urgent cases but they line up dun sa ER. Kaya napupuno rin. So nagkaroon po ng pag-uusap katulad nung nangyari nun sa PGH. Nag-usap po sila with the region. So yung region namin, minobilize nila yung navigation natin para hindi na basta-basta nag-walk-in ang mga pasyente, mabawasan din yung load ng mga ospital natin. We are trying to work things out with our patient navigation and referral center, and hopefully our regional navigation and referral centers will also be activated and mobilized so that hindi po napupuno ang mga ospital.
Pero nag-ease na siya, no? After a surge.
Opo, parang nabigla, alam niyo po yun. Tapos after a while, we were able to manage, no? Because hindi naman talaga in-expect na biglang dadagsa at biglang dadami. But according to our big hospitals nga, this is the usual number of patients. Nagkataon lang talaga na nagkasabay-sabay during that time.
Ma'am, I'm just curious what happened during the pandemic in terms of our young people's interest in the medical industry, in having careers, whether as doctors, nurses, public health, and so on. Tumaas po ba o bumaba ang interest ng kabataan sa ating mga medical professions?
Well, we haven't thoroughly analyzed this matter yet, but I can say that I think with this heightened awareness, especially among our youth at this point in time and during this pandemic, and even during the pandemic, there were a lot of volunteer groups ng mga youth po na tumutulong po sa Department of Health at saka sa mga local government. I think po magtataas naman yan, but it still depends, of course. Marami pong factors kapag mag-enroll ka sa mga healthcare or medical field professions, because resources would always matter pagdating po dyan.
Okay.
Usec, pahabol lang. We're in transition. Baka naman may balita na kayo kung sino yung magiging DOH chief.
We still have not received any information at all, and this is the truth, And as from the DOH, is still also waiting so that we can also plan better, para po dun sa transition, because as you know, the personality and the focus of the incoming Secretary of Health would greatly matter in our transition planning para po naiayos po namin yung mga endorsements natin. So hanggang sa ngayon, wala pa po kaming information. Of course, the Office of the President and the next administration will be announcing this, and I hope hopefully soon.
Nako, Ami, mukhang kailangan punuin mo muna ng ibang storya yung nakabakante dyan sa front page mo. Hindi ka nakakuha ng scoop.
Oo nga.
Okay. Well, anyway,
bukas meron na.
But whatever information you can share with us, we always appreciate. Undersecretary Vergeire, maraming salamat po sa inyo.
Thank you, Usec.
Maraming salamat po.
And that will be all for this edition of The Chiefs. We hope what was discussed here will keep the conversation going. Before we go, a reminder to everyone, mask on, wash hands, stay safe, Philippines. I'm Roby Alampay.
I'm Pamintuan of the Philippine Star, and we are One News.